8:11 p.m. St. Haven Memorial Hospital. A SEAL captain lay on the gurney, his arm pale, swollen, and losing blood flow fast. Two surgeons hovered over him, arguing in low, grim voices. "Circulation's gone," one whispered. "We may have to amputate." The captain clenched his jaw until he saw her. A rookie nurse walked in quietly, carrying a tray of medication, young, blonde, soft-spoken, the kind everyone overlooked. The surgeons didn't even pause, but the captain froze. Then, to everyone's shock, he lifted his good hand and saluted her. He whispered, voice trembling. "You saved me once in Iraq. Don't you dare let them take my arm." The room went silent. She tried to step back. "No, I'm not that person anymore." But the captain locked eyes with her. "Corman, please. You're the only one here who knows how to fix this." The surgeon scoffed. "A nurse? This is impossible." She looked at the dying arm, the collapsing artery, the memory she'd buried. Then she said softly, "Give me 3 minutes." And what she did next, no civilian hospital had ever seen before. Before we begin, take 2 seconds to comment where you're watching from and hit subscribe. Your support keeps these stories alive. Alright, let's get into it. 8:06 p.m. St. Haven General Hospital. The ER was unusually loud for a Tuesday night. Residents scrambled, nurses rushed, alarms chimed, and stretchers filled every corner of the trauma floor. Nobody noticed the paramedics rolling in yet another patient until they saw the uniform. A Navy SEAL captain, tall, muscular, jaw clenched, face drained of color. His left arm strapped to his chest with makeshift bandages soaked through with darkening blood. A training accident, they were told. Broken arm with severe vascular compromise. Possible amputation needed. 2 residents gasped. One whispered, "I've never seen an arm that swollen." The trauma surgeon on call, Dr. Rowan Hale, the region's best, stepped forward with that cold confidence surgeons wear like armor. "Let's get him to Bay 4, Hale ordered. "Prep for surgical amputation. He's losing the limb." The SEAL captain didn't flinch, but his jaw tightened just enough to betray pain. He gripped the stretcher rail, breathing in short, controlled bursts, the way soldiers do when they refuse to show weakness. "He's a fighter," a resident said. "No," Dr. Hale corrected. "He's a man about to lose an arm." They pushed him into Bay 4, curtains half-drawn, fluorescent lights reflecting off metal trays. A nurse read off the vitals, voice shaky. The captain shut his eyes, swallowing hard, his breathing steady but forced. The residents gathered around, excited to witness the surgeon at work. Then the curtain rustled. A young woman stepped in quietly, almost unnoticed. Rookie nurse. Light blonde hair pulled into a low bun. Blue scrubs slightly too big for her. Clipboard tucked into her elbow. Eyes soft, posture timid. A girl everyone ignored. Her name tag read. Nurse L. Carter. "What are you doing?" Dr. Hale snapped. "This bay is restricted. We are prepping for surgery." She froze mid-step. "I was just asked to bring the injection kit." A few residents chuckled under their breath. "Of course, the rookie is lost," someone muttered. But the SEAL captain opened his eyes at the sound of her voice and everything in him stopped. He blinked, stared, focused. Then without warning, he tried to sit upright, pain tearing across his face, but he forced through it. Even Dr. Hale stepped back from shock as the SEAL captain raised his good arm to his forehead and saluted her. Dead serious, perfect form. No hesitation. A salute weighted with history. The room fell silent. Even the machine sounded quieter. The rookie nurse's face went pale. "Sir, please don't. You'll hurt yourself." "You?" The SEAL captain breathed, voice cracking. "I knew it. I knew I wasn't imagining it." "Carter. Foxglove. Is that really you?" A resident frowned. "Foxglove." Another whispered. "Is that a call sign?" Nurse Carter stepped back, shaken, her throat closed up, hands trembling just slightly. "I'm not her anymore," she whispered. But the captain wasn't hearing it. His eyes were burning with a mix of pain, respect, and something like gratitude. "You saved my life in Iraq," he said. Chest wound, ambush en route Anbar. "You carried me out when the others." He swallowed hard. "You got me home." The residents froze. The surgeon's confidence fractured. Even the monitors seemed to pulse slower. Nurse Carter looked away sharply. Please, I don't do that anymore. Hale coughed, trying to regain control of the scene. Miss Carter, whatever your past is, this is a surgical case. His limb is gone. We are prepping for amputation. Her head snapped toward the scans on the screen, and something in her changed. The timid posture vanished, her eyes sharpened, her breathing steadied. The soft-spoken rookie nurse was replaced by something colder. Trained, disciplined. Why amputate? She asked quietly. Hale scoffed. Because the radial artery is collapsed, circulation's gone. Tissue necrosis is minutes away. This is not a nurse-level case. She stepped closer, but the compartment pressure looks reversible. It's not. Yes, she said, voice suddenly steady. Yes, it is. Hale crossed his arms. You think you know more than I do? The SEAL captain exhaled in pain. Let her try, he said through his teeth. If anyone can save my arm, she can. Hale spun toward him. Captain, with all respect, she's a rookie nurse. She's not qualified to. Carter wasn't listening. She leaned over the injured arm, her fingers moving with precision no rookie should have. She pressed along the muscle compartments, analyzing pressure, direction of swelling, mapping the vascular collapse with touch alone. Sir, she said to Hale, this isn't necrosis. It's delayed arterial spasm with collapse from the trauma load. The fragments are compressing the sheath, not severing it. Hale opened his mouth, then closed it. Residents blinked in confusion, because none of them had ever even heard the terminology used outside battlefield med-tents. What does that mean? A resident asked. Carter looked up calm and certain. It means we don't amputate. The SEAL captain exhaled in relief, gripping her wrist with gratitude. I told you, he whispered. Foxglove always saves her people. Stop calling me that, she murmured. Hale clenched his jaw. Even if you're right, no civilian hospital does that kind of stabilization. She hesitated, then quietly said the words that froze the room again. I do. Hale stared. You're telling me you know a technique that isn't even legal outside combat zones. I'm telling you, she replied softly, that he'll lose his arm if we wait for you to prep the O. The SEAL captain nodded, eyes locked on her. Please, he said, just try. She closed her eyes for a moment, her breath shook, memories she never wanted, resurfacing, blood, dust, her partner dying in her arms, her hands failing him, her voice begging him not to go. But she opened her eyes again, steady, focused. Fine, she whispered. I'll do it. The resident stepped back instinctively as if witnessing something sacred. Carter grabbed the sterile kit, sanitized, gloved up, then positioned herself at the SEAL captain's side. Pressure the proximal section, she ordered. Hale blinked. What? She looked up. If you want to help, she said evenly. Hold pressure. Now, no one had ever heard her give a command before. Hale obeyed. She worked fast, controlled, confident, hands moving like someone who'd done this 100 times under gunfire. She performed a stabilization release maneuver. None of the residents recognized, something taught only in elite combat medic programs. The SEAL captain clenched his jaw, gasping, but then his fingers twitched. Then again, then slowly blood flow returned. Color crawled back into the hand. A resident whispered, What? What did she just do? Hale stared like he was witnessing a miracle. And Nurse Carter stepped back, chest rising and falling, eyes glassy with memory she couldn't escape. It's done, she whispered. His stable, the SEAL captain breathed out in relief, tears forming. Foxglove, you saved me again, the rookie nurse swallowed hard. I told you, she said quietly. I'm not her anymore. But before anyone could speak, a voice from behind the curtain said, Actually, we need to talk about that. Carter turned slowly and froze because standing there was someone she never expected to see again. Someone who knew exactly who she used to be and why she left the military forever. The moment the curtain slid shut behind them, the room changed. The chatter outside faded. The fluorescent lights hummed overhead. The SEAL captain sat upright, cradling his swollen arm, eyes fixed on the rookie nurse like she was a ghost pulled straight out of the desert sand. Emma Hayes kept her gaze on the supply cart instead. She pulled gloves, alcohol wipes, sterile packs, anything to avoid meeting his eyes. Emma, Captain Cole said softly. She froze. He hadn't said her name like a question. He said it like a memory. But she kept prepping the injection tray, pretending not to hear. If she let him speak, let him remember. Let him bring the past into this room. Everything she had rebuilt in the last 7 years would crack open again. "You don't have to do this," she murmured. "I'm just here to give the antibiotic injection and leave." He exhaled a slow breath that carried a weight no one in this hospital would ever understand. "I know who you are," he whispered. Her hands trembled for the smallest second, but she didn't turn. "You shouldn't," she said. "That life is gone. Let it stay gone behind them." Dr. Kellen stood by the computer charting notes loudly on purpose. Still irritated that a rookie nobody had been allowed inside his trauma bay, he tapped his pen against the desk, glancing at Emma with thinly veiled annoyance. "You done yet?" he muttered. "We need to prep for amputation. The longer you're in here, the more time we waste." Captain Cole's jaw tightened. "We are not amputating. You don't get a vote." Dr. Kellen snapped. "You're the patient. I'm the surgeon." Emma stepped forward, then slow, quiet, but with that strange calm she always carried. "Sir, your patient's perfusion is decreasing. The window is shrinking." Dr. Kellen shot her a glare. "Thank you, nurse. I'm aware of my job." But Captain Cole wasn't listening to the surgeon at all. Only to her. "Do you remember Fallujah?" he asked. Emma's breath caught. She shut her eyes for one heartbeat. Maybe two. The memory wasn't a single picture. It was a flood. Shrapnel slicing the air, sandstorms choking the sky, her partner Aaron falling right in front of her, and the sound she could never forget, a gunshot cutting through the heat like a knife. When she opened her eyes again, everything about her face had changed. "Yes," she whispered. That was the first moment Dr. Kellen finally looked at her. Really looked at her. There was something in her posture he'd never seen from a rookie. Something controlled, trained, military, but he dismissed it just as quickly. "Captain, I know you're emotional, but this nurse is not qualified for anything except handing me supplies." Captain Cole lifted his uninjured hand slowly and saluted her. Dr. Kellen's jaw fell open. "Nurse Hayes saved my life," Cole said, voice steady. "She dragged me half a mile under gunfire with a bullet in my lung. If there's one person in this hospital I trust more than you." His eyes moved to Dr. Kellen, cold and clear. "It's her." Emma's heart dropped into her stomach. This was exactly what she feared. Recognition, memory, exposure. She kept her voice low. "Captain, that was a long time ago. And you're still her," he said. Dr. Kellen slammed his chart shut. "Enough. This is absurd. Nurse Hayes, step away from the patient." But Captain Cole didn't let her. "Emma," he murmured. "Look at my arm." She did. The skin around the bicep was turning a sick shade of purple. The pulse at the wrist was faint, barely there. His hand was already colder than it should have been. Compartment syndrome. Crushing pressure. No blood flow. If they didn't restore circulation in minutes, the arm was gone. "What do you see?" he asked quietly. Emma swallowed. She saw it all. Things no one else in the room would ever recognize. "Pressure lockout," she whispered. "Vascular choke. Your forearm fasciotomy was done wrong." Dr. Kellen stiffened. "Excuse me." Emma didn't back down. "The previous cut wasn't deep enough. Blood's trapped. If you amputate now, you'll amputate a salvageable limb." Dr. Kellen scoffed. "You're guessing." "She isn't," Captain Cole said firmly. Emma shook her head hard. "Don't say that." "Why not?" he challenged. "You saved me once. Save me again." Her eyes flickered, not to the surgeon, not to the wound, but to something far away. A face she would never see again. Her partner, the one she couldn't save, the reason she left the military. "This is different," she whispered. "No," Cole said softly. "This is the same. Someone is going to lose their life or their arm unless you step in. And I know you can do it." Her breath shook. Dr. Kellen threw up his hands. "This is ridiculous. We don't have time for sentiment." Then something happened he didn't expect. Emma moved. Not fast, not loud, but with purpose. She reached for the sterile kit, tore it open with practiced precision. Her body shifted into that stance, the one only combat medics used when they were seconds away from losing a soldier. Dr. Kellen's face twisted. "What do you think you're doing?" Emma didn't look at him. "Sir," she said calmly, Your patient has a collapsing radial pulse modeling in the fingers and a vascular block that's seconds from irreversible shutdown. If you amputate now, you'll amputate a limb that can be saved. That's my decision, he barked. No, she said quietly. It's the correct medical decision. Captain Cole watched her with something that wasn't fear anymore. It was respect. Emma placed her fingers gently along his arm, feeling the pulse line. There, she whispered. It's trapped under the fascia. How do you know? Dr. Kellen demanded. She finally looked at him. I've relieved this pressure in the field twice. Dr. Kellen recoiled. You in the field? Emma didn't blink. Under fire. The room went silent. Then the surgeon said the one thing she knew he would. I won't authorize it. Emma knew this would happen. She also knew what came next. Captain Cole lifted his chin. I authorize it. You can't. Dr. Kellen sputtered. Cole cut him off. It's my arm, my decision, and I choose her. Emma breathed in slowly, steadying her hands, steadying her heart. No civilian nurse should know this technique, Dr. Kellen said. No civilian nurse does, Cole replied. Emma met the surgeon's eyes finally, openly. Step back, she said softly. Dr. Kellen hesitated. Captain Cole didn't. Do it. Emma. Her fingers tightened around the scalpel. She whispered almost to herself. Please don't make me remember this. But it was too late. Her past was already awake. She made the first incision. Dr. Kellen gasped. No, that's wrong. Emma didn't stop. She opened the fascia along the trapped vessel, the combat medic way, defying every civilian protocol in the book. For 4 seconds, nothing happened. Then, blood flow surged. Color returned to the hand. Captain Cole exhaled, relief crashing through him like a wave. Emma stepped back, shaking. The room was silent. Dr. Kellen's face went pale. Captain Cole whispered one word. Valkyrie. Emma turned away instantly. I'm not her anymore, but her voice cracked. Dr. Kellen stared between them, stunned. Who? Who are you? Emma didn't answer. She walked toward the door slow, silent, leaving the room in absolute disbelief. But before she reached it, a voice behind her stopped her cold. Wait! She froze. Captain Cole said softly. Emma, there's something I need to tell you. Her blood ran cold. And when she turned around, he wasn't looking at her wound or the tray or the surgeon. He was looking at her with something deeper, something dangerous, something she wasn't ready to face. It's about Iraq, he whispered. And the day you think you failed. Emma's chest tightened, her fingers curled into fists. The past she tried to bury wasn't done with her. Not even close. Comment: never judge if you're still with the story. The surgical team dispersed. Across the hallway like a tide retreating after a storm, carrying tablets, forms, and concerns that seemed to echo through every corner of the orthopedic wing. But Ava remained still. She leaned against the wall outside Recovery Bay 4, staring at the floor tiles with the same expression she had worn in Iraq the night. Everything changed calm on the surface, but cracked underneath. Only now she wasn't holding a rifle. She was holding a clipboard. Inside the room, Captain Cole Harrison rested with his arm finally wrapped, stabilized, and saved by her. The very thing the surgeon wanted to cut off, she brought back with a maneuver no civilian medic would ever dare attempt. The attending physicians left the room whispering to themselves, trying to piece together how a nurse, a rookie one, reversed something they had already declared hopeless. Dr. Vargas, the senior trauma surgeon, walked past her, pausing only long enough to avoid eye contact. You went beyond your role today, he muttered. She nodded. Yes, sir. He hesitated, something uncharacteristic for him, but you also saved his arm and maybe his career. Then he left. She exhaled shakily, pressing her thumb against the spot where her ID badge hung. She expected reprimand or praise or anything, but mostly she expected silence. That was what she was used to. That was what she'd accepted. A quiet nurse in a loud world. The door opened. Captain Harrison stepped out, still in his hospital gown, sling supporting.